Good morning, everybody. Thank you for being here today. My name is Nicole Brenner, and I have the privilege of serving as the hospital president here at Novant Health Kernersville Medical Center. The group gathered here today from the State Treasurer's Office, the State Health Plan, Lantern, and Novant Health share a commitment to improving access to quality health care to the people of North Carolina. Today's announcement is about more than a new program. It's about reducing barriers for state employees and their families to high-quality surgical care. You'll hear today from leaders who are deeply committed to doing healthcare differently and better for the people who serve our state. To start, I'm pleased to welcome North Carolina State Treasurer Brad Briner to offer some remarks.
Thank you. Good morning. I want to thank everyone for being here, but I especially want to thank our partners from Lantern and Novant. We need partners who are willing to rewrite the playbook when it comes to healthcare, and they are leading the way. I also want to thank our partners in the General Assembly for being here. Senator Jones, Representative Zinger, your support in keeping the state health plan solvent is essential, so thank you for it. Last year was one of the most challenging years in North Carolina state health plan history. Rising medical costs, stagnant premiums, and increasing provider prices placed a real strain on the state's finances. We're staring at a projected shortfall of $507 million that demanded serious, responsible action. We made tough decisions. We scrutinized every nook and cranny where we could find funding. And we committed to one clear goal: make the state health plan sustainable. This year, our focus is also straightforward: cut unnecessary costs from the system so we don't have to raise the burden on our members. That's why we're expanding our no-cost surgery options for members of the state health plan, especially in our suburban and rural communities. Here's the reality. Too often, the price of the same surgery can vary dramatically depending on where it's performed. One hospital may charge 2 or 3 times more than another for exactly the same procedure with no difference in quality, and a high chance that our members won't even be aware of the difference. Those inflated costs don't just hurt the plan. They eventually put pressure on premiums, deductibles, and the long-term sustainability of coverage for our teachers, state employees, and their families. We refuse to accept that as the status quo. By expanding partnerships with our high-quality surgical providers who agree to transparent, fair pricing will mean much less strain on the plan. At the same time, it offers members access to certain procedures at no out-of-pocket cost. That means no deductible, no copay, and no coinsurance for eligible surgeries when members choose participating providers. This is especially important in rural North Carolina. For too long, rural communities have faced limited provider options, longer travel distances, and in some cases, much higher costs. It's time to reverse this trend. And instead, we need to serve our members where they live and they work. We're here in Kernersville today, home to 30,000 North Carolinians. Many of the residents here teach our kids, patrol our highways, guard our prisons. These state employees and their families deserve to have affordable healthcare options right in their own backyards. By partnering with a major healthcare network like Novant Health, who has locations in Forsyth County, but also in Charlotte, Greensboro, Thomasville, Salisbury, and Bolivia, this expands our cost-conscious surgical options, giving our rural and urban members more choice, more predictability, and more financial security. It also sends a clear message to the market. If you want to serve state health plan members, you must offer value. Let me be clear, this is not about cutting corners, it's about cutting waste. We are demanding high-quality outcomes and accountability. We are aligning incentives so that providers are rewarded for their results as well. But while cutting unnecessary provider costs is essential, the key to long-term sustainability is even more important: keeping our members healthy. The healthiest surgery is actually one that never has to happen. That's why we continue to emphasize preventive care, early detection, chronic disease management, and primary care access. When members stay healthy, when diabetes is controlled, when blood pressure is managed, when screenings happen on time, costs stay down and quality of life goes up. Financial discipline and preventive health go hand in hand. The state health plan cannot simply absorb ever-increasing provider prices and hope the math works out. It won't. We've tried. We must actively manage costs, insist on transparency, and protect the people who serve this state, our teachers, our law enforcement officers, our state employees in every county. Expanding no-cost surgery options is just one piece of a broader strategy, a strategy focused on value, transparency, accountability, and the health of our members. If we get this right, we don't just balance a budget. We build a stronger, more sustainable state health plan. We are in this together, and together we can keep our members and our plan healthy and financially secure. This is our responsibility, and it's exactly what we intend to do. Thank you. Now, Tom Freeman, Director of the State Health Plan.
It's always an honor and a challenge to follow the treasurer because he's so good at what he does. It makes it difficult to follow. But I want to talk about the member, and the member is the key to our success in these partnerships. But I want to talk about why this partnership is so important from a member point of view. We have tens of thousands of people needing surgery every single year. That is really scary and really hard. And we call these electable surgeries, but we can't ask people to do mountains and mountains of research on who is the highest quality surgeon, where should I go, where should my spouse or where should my parents sit for care, what should I do? That while you have a choice, it's not a fair choice. It's not a reasonable choice to ask people to make. And because we give them that choice without information, a lot of times people make the bad choice. They get readmitted because they didn't go to the right provider because there's too much on their plate. And on top of that, they're out of pocket up to $5,000, up to $10,000 if they're on a family plan, which can be 20 to 40% of their salaries. That's too much. When we started the program with Lantern, there's obviously skepticism from our members. They're skeptical a lot, and rightfully so. They thought free meant bad. They thought no cost meant we're going to send you to, Tom Friedman's doctor shop in the middle of nowhere for care. You can physically see people loosen and calm when we say Novant is our partner in this transaction. Novant is across the state. They are known as a high-quality North Carolina-based system. You can feel everyone relax. You're telling me I can get a free surgery at Novant with the highest quality providers in the state of North Carolina. In your most difficult time, that is a relief. And then we have our partners at Lantern coming in, helping transfer your medical records, help schedule appointments for you. We need to make this very difficult time as simple as possible for members. Not make it be a financial burden, not making it be a challenge, because it's already scary and it's already hard. So we are so grateful that Novant stepped up and really brought a statewide presence here, because it's a different thing. It's doing healthcare differently. And just really grateful for your leadership and your partnership. With that, I'm going to turn it over to Dr. Oliver. Thank you so much.
Thank you for the introduction, Tom, and good morning, everyone. It's my pleasure to be here with you today. Novant Health exists to create a healthier future for the communities that we serve. A key part of that work is making sure that people have access to high-quality care when and where they need it. Safety and quality are the core of everything that we do. We are nationally recognized for our commitment to delivering high-quality care, and that commitment shows up in our day-to-day practices and how we prepare patients for surgery and how our surgeons prepare themselves and the expertise that they have. And it also shows up in how we support recovery after the procedure. For most people, surgery is more than just a clinical decision. It's a significant life event. When you need it, it is also about taking care of your family, taking time away from work. It's about coordinating appointments, managing logistics, and thinking through the financial side of care. All of that can weigh heavily on patients and their decisions and on their loved ones. We are here to make the cost of care, both financial and emotional, easier to carry. We're proud to partner with the North Carolina State Health Plan and Lantern to help give state employees access to affordable surgical care closer to home. For state employees and their families, this partnership expands across procedures, access to procedures that contribute to quality of life. Whether we are alleviating back pain or returning mobility through a joint replacement, our state health plan members can rest assured that they're receiving expert care at no additional cost. We've seen firsthand how these models can deliver the caliber of care patients deserve while alleviating financial concerns. In fact, we have similar approaches for our own team members, including programs for joint replacement, maternity services, and spine care. This partnership reflects a shared commitment to doing healthcare differently and better for the people who keep North Carolina running. We're proud to be part of that effort, and we look forward to the positive impact that it will have for our patients and our communities. Now I'd like to invite Lee Mendez from Lantern to say a few words.
Good morning. It's a pleasure to be here. Lantern provides access to a high-quality network of curated surgeons and facilities at no cost to the member. We achieve this by identifying high-performing surgeons and facilities, aligning pricing to quality standards, and simplifying the experience for our members. When a member needs surgery, they are connected with a dedicated care advocate that guides them from the beginning all the way through to recovery. They help coordinate care, schedule appointments, and manage medical records on behalf of the member. Our commitment is to continue to expand the network across the state, increasing access while maintaining our rigorous quality standards. At the core, Lantern's approach improves affordability and availability by aligning incentives around better outcomes, because quality is the most substantial cost strategy in healthcare. We're excited to work with Novant and with the state health plan to expand access to high quality, no cost surgical care to thousands of North Carolinians.
All right, I would like to just extend again thank you and gratitude to our partners and speakers today, and would like to open it up for any questions that the folks here would have for our speakers. Okay. If there are none, this is the close of our program, and we really do appreciate everybody coming out today, and looking forward to seeing you all again soon. Thank you.